I got into medical school and actually into physiatry through sort of a circuitous route. I went to undergraduate at Vanderbilt and I studied psychology and literature. Had minimal interest in medicine at the time. Chose later on to go to medical school when I decided to be a psychiatrist, a mental health professional. I'd worked in mental health for a couple of years before. By the time I got to medical school, I discovered rehabilitation medicine. I went to Northwestern University, which has arguably one of the highest prestige rehab institutes in the country. I was exposed to rehab, and frankly, I just loved it. I loved the practical aspects of dealing with the many aspects of someone's physical disabilities. I loved the team approach, and I loved the comprehensive, practical approach to helping people get better, working with the team. So while I do have an interest in both psychology and psychiatry, I just love the wonderful spectrum of skills that go into being a good rehab physician. I'm a physiatrist or a rehab medicine professional, and so my primary role is that of medical rehabilitation, management of the issues that impact on physical functioning. From a medical perspective, that will include medication adjustments. Common examples would include pain, spasticity, sometimes what we call neuroactive medications, whether the individuals are depressed or other related things that are going on. A lot of what I do is coordination with other healthcare professionals, particularly other subspecialty physicians, orthopedic surgeons, neurosurgeons, rheumatologists, internists, really across the whole spectrum of people. And then as a physician with a particular interest in physical functioning, I work with an interdisciplinary group of health professionals called the rehabilitation team, and this includes nurses, physical therapists, occupational therapists, speech therapists, frequently psychologists, and neuropsychologists. And to me, what's exciting and fun and very gratifying about working in rehab is working with this diverse group of people to really evaluate and address the many aspects that go into someone's condition. In rehabilitation, we talk about the biopsychosocial model, and I think we embrace it wholeheartedly. And my role as the medical rehabilitation physician is to manage medical issues, facilitate and lead these activities. The academic center allows for a wonderful diversity of patients and intellectual stimulation. Healthcare is changing dramatically. The knowledge base is expanding in an exponential fashion. Things that I wouldn't have thought of in the 80s when I was in med school are now routine activities. So there's a great stimulation of being around cutting-edge science, of having people in education programs, trainee programs. We work most directly with postgraduate medical education with our residents, but we also have some interface with medical students, with PT students, and frankly, students keep you sharp. Students ask good questions, and they give you a chance to really refine your own skills, and it's a dynamic, professionally satisfying activity. One patient I was thinking about was a gentleman who was recently discharged. He came to me initially after he'd had a work-related accident. I believe he'd fallen out of a truck, had severe neck pain, and had undergone a neurosurgical procedure to try to alleviate that. He had some ongoing weakness and very severe pain. And as an outpatient, I worked with him for probably close to a year, making adjustments in his pain management, getting him involved in therapy, and frankly acting as a cheerleader. In the midst of this, while he was actively engaged in therapy, he also really struggled with depression. And depression became such a severe issue that at one point we were concerned about even a suicide risk, and I had to work closely with his spouse, and I got some psychiatrists involved. Later on, as his pain became more severe, I helped facilitate a more detailed reevaluation of his spine. The neurosurgeons decided to go back in and reoperate. He was still having pain after the operation, but the pain started to diminish, and what was most gratifying is the use of his right arm started to diminish. I had gotten close to him personally. I acted both as a physician and as a cheerleader and a supporter to both him and his wife. It was very gratifying to see him not only physically get better in terms of the use of his arm, but to work with him to make a dramatic reduction in the use of his pain medicine, and to work with him in terms of his whole attitude and kind of taking charge of the condition. What sometimes happens in these very complicated conditions is that the condition will take charge of the person as opposed to the person taking charge of the condition. And it was gratifying to work with him, to work with the staff, work with the family, to help him sort of come to terms with his both pain and weakness, and to also help him find better ways to use some of the strength that is regained and more effective ways to control his pain. Emory is a wonderful, skilled, what we call tertiary care or highly specialized medical system. We have physicians and healthcare providers. Who are internationally recognized across a broad spectrum of conditions. So one is the full environment of experts who can help manage complex patients. The Emory Rehab has an established history of dealing with both what we call routine patients and complex patients in a very satisfactory manner. We rate quite well on the national measures of functional improvement, of patient satisfaction. And so I think that you would choose, one would choose Emory because of the wonderful, effective professional staff, both physicians and non-physicians, the outcomes, and the broader context of highly skilled professionals who are available to manage their care. Well, my family is really important to me. I'm going to be an empty nester soon, so that's going to be a transition. But I really enjoy bicycle riding. It's something I've done intermittently, and in the last several years I've taken it on more seriously. I've now done a couple of centuries. A little sore afterwards, but I'm very pleased with that. It's a great sport. It's a great sport for getting outside, cardiovascular endurance, and things like that. I love to travel. My wife owns a small store in Decatur, which she travels a lot, and occasionally I'm able to join her, and I look forward to doing more of that. And I enjoy reading fiction.